Hi, everyone, and welcome to another episode of Wellness Day, a podcast coming to you every Wednesday here from the Jahangir Wellness Center. My name is Kavas Jahangir, and here from the JWC studio, our new JWC studio here at Viman Nagar is something I wanted to take you and walk you through as we walk to our next guest today. So that is something new that I wanted to show you. So welcome to our new center here at the Viman Nagar Clinic. Thank you. This week we've got a very special episode. We're talking about Bach flower therapy. It's something that actually I've recently started as well. So I've got Dr. Navya Prasanna here, who's going to be talking to us about Bach flower therapy. She's a Bach flower therapist, or she's a Bach flower practitioner. And something that's completely new to me, something that I've just started. So thank you so much for being here, Doc. It's an absolute pleasure. And I'm very excited to talk about and help everyone understand what Bach flower therapy is.
Thank you so much for having me over for this podcast. I first of all thank and I'm very grateful for JWC to introduce Bach flower therapy into their wellness program.
Yeah,
So,
absolutely.
yeah.
I mean, as I said, I've recently started it with you, just to put that so that everyone is aware of that. So I'm actually quite keen to see how the effects take
Yeah.
place. But why don't we just start with what is Bach flower therapy? Because I'm sure most people may not know about it. I honestly did not know about it until we started it here at the JWC ourselves. So why don't you just tell us what that is?
Before I start Bach flower therapy,
Yeah.
I would like to mention what emotional wellness is.
Oh, okay.
So, emotional wellness, if you have to define, it's like if you ask any other layperson, they would say, oh, if you're happy, you're emotionally well.
Yeah.
Always, that's not possible. You cannot be happy all the time. It's not possible.
Yeah, yeah.
So, emotional wellness is something where you have acknowledged your emotions, you have addressed them, you have accepted, and you are managing them. The National Center of Emotional Wellness in US has very well defined emotional wellness as awareness, acceptance, management through challenges and changes.
Okay.
So this is what emotional wellness right now is why important, because that is connected with our Bach flower therapy.
Okay.
So life is a roller coaster.
Right.
Nothing is going to be simple.
Yeah.
It's going to be all ups and downs. Sometimes even a simple emotion of grief is needed because it's through that process when you heal, you can move on. So acknowledging, feeling those emotions fully, coming to being a resilient and managing your emotional balance is what is emotional wellness is. Now, how is it with Bach flower therapy? Because Bach flower therapy is completely about emotions. This therapy remedies, they are emotional wellness remedies. The medicines are made from flower essences.
Okay.
And this was discovered by Dr. Edward Bach, a British physician in 1930s.
So fair time ago now.
Yeah.
Only 100 years.
Right. And he found he made many remedies, but these 38 emotions were the main ones where every specific remedy had a vibrational and an energetic essence in the remedy. So it works with our energetic emotion
Right.
and then balances it. So that's what is about emotional, about Bach flower therapy.
Okay.
So here the remedies are specifically designed for every emotion in you. So it's fear.
Those 38 that you were talking
38.
about.
So it's fear, it's anxiety, it's resentment, it's loss of confidence, anger. And these, when given, will manage your emotional balance. They'll give you an inner calm and help you in better wellness.
Okay. I mean, that was going to be my next question is that, for people who are hearing about this for the first time, how would you describe Bach flower as being a remedy, how it actually works?
Yeah. So actually, they don't suppress emotions.
Right.
They work with, the intent is very gentle shift of the negative emotions or negative pattern to the positive state. So it's they're not suppressing.
That's
So
very important to for
yeah.
people to know, actually. Yeah.
So it's like they're very gentle, they're safe, they're non-addictive. So somebody who's got, I can give you an example.
Please.
Somebody's got fear. So a remedy called Mimulus. If you administer that remedy, that person slowly will start having courage. Somebody who's got constant thoughts, that person will become a little calmer. Somebody who's overwhelmed of everything around will start feeling a little emotionally lighter. So these actually work on a very holistic approach by taking care of your emotional balance.
Okay. So how do you address this for people that, are sort of skeptic, think that this is just like a placebo, or, this is just a different form of homeopathy, or, those kind of thoughts that
Okay.
people would have?
So I feel skepticism is healthy.
Good. I like that. That's
It's healthy, and it's something that I think every field, every medicinal field or any field has its share of critics and criticism. Nobody's going to be out of it.
Yeah.
So even homeopathy, Ayurveda, and many other alternative therapies, they have all gone through this critics.
Scrutiny.
Yes, even psychology.
Yeah.
So all have
That's
gone
true.
through that. Yes.
Very true.
So a lot of research and documentation has proved bark flower therapy, when remedies are given to the people, patients, they have come with results of feeling calmer, they're feeling better,
Yeah.
they're feeling, someone who comes and says, I'm feeling peaceful inside, itself says, it's got some validity proof.
Yeah.
Yes, there must be not a lot of pharmacological tests done, or maybe not a lot of scientific papers, but a little gentle and slow shift and a emotional shift in a individual will always deserve respect.
Yeah. But that's why it's so interesting what you said earlier, is that this is not trying to suppress any emotion or any kind of being. While one can argue that, hard medicine or pharmacology actually does that for a lot of drugs. It's a suppressant
Yes.
of, certain chemicals, which eventually are emotions. But so I found that very interesting, that in the case that you're talking about for bark therapy, it's actually not trying to suppress anything, but, while on the other hand, there is some medicine that is out there that actually just suppresses it. So I found that like an interesting contrapoint. Well, then, taking that, step further, what are the most common things that people come to you for?
Common type of people?
Common type, common,
Yeah.
I don't want to say ailments, but ailments where they come to you seeking.
Yeah. Actually, there's no proper type or demographic
Yeah.
for bark flower therapy. I've got all kinds of people who walk in,
Yeah.
all walks of life. Children,
Okay.
teenagers, elderly. You've got professionals. You've got entrepreneurs, housewives.
Yeah.
All have these issues, and somewhere they are having a lot of challenges now with relationship stress,
Right.
office pressures, parenting, social comparison. There's so much of financial insecurity.
Yeah,
So all
absolutely, yeah.
different type of, and in this process, they are trying to show how happy they are outside, but eventually they are struggling inside.
Yeah.
So there's a lot of masking, and in this masking process, you end up eventually having a lot of physical issues. Your sleep disorder,
I was going to ask that next. How does it manifest physically?
your sleep disorder, your
Yeah.
digestive issues, gut issues.
Yeah.
Then you have your weakness of immunity is weak, for the energy levels weak. So all these kind of people have.
Right.
Yeah.
In your many years of experience, I'm sure you've got many stories and many experiences. Any ones that stand out to you as powerful examples about how well this works?
Yes, somebody with fear.
Okay.
Somebody who's come with fear, a patient coming with fear, literally was crying. He came to a JWC and he was crying and was helpless because just couple of days back, he had his colleague who passed away with his cardiac arrest. And he didn't know, he felt every emotion in him, like probably he was getting a cardiac arrest. And then gradually, when we medicated him,
Yeah.
we gave him these remedies. After a month, comes and asks me,
Hmm.
where has my fear gone?
Wow.
I said, "You just relax. The emotion is now, we have removed the negative.
Hmm.
We've shifted the negative emotion. You're feeling better. That itself is the cure."
Yeah. And again, you're not suppressing anything, you're just dealing with it or you're addressing it.
Yes.
Fascinating. How did you get into this space?
Yeah, actually, I'm a homeopathy doctor
Okay.
by training. Uh, 2005, I was in UK, where this Bach flower therapy is born.
Hmm.
So I did a lot of workshops, research.
Right, right, right.
And at the same time, my mom in India was going through a lot of her health issues.
Right.
Since I was learning Bach flower therapy, I started, why don't I start giving her and start myself, because when you are away from parents,
Yeah, yeah.
you know how you are.
Right, right.
So it happened that I could gradually see the difference, how it helped both of us. And that was my turning point in 2005, where I realized emotions do play a major role
Hmm.
and influence your health.
Right,
physical health.
right. And like from what you're describing, you must be as much a therapist as you are a practitioner of just simply giving the certain medicine. It's not just that; it's about understanding
Yes.
the problem and addressing it with the patient or the person to give them the right kind of therapy or medicine, as you call it. Yeah.
More than my profession as a Bach flower practitioner, it's become my passion.
Really.
Because I'm getting the joy and pride when a patient or individual comes back to me and says, I'm feeling good. I can see the transformation in their lives, the happiness, the feeling of the good feeling.
Yeah. So how do you deal with this for your own mental health when you have, these heavy issues that of course people come to you with it? How do you go home and leave work at work?
Oh yes, I even myself need to do a lot of cleansing, because I'm dealing with a lot of
Yeah, yeah, absolutely.
emotions.
Absolutely.
And so there's a lot of cleansing, as well as I also need Bach flower
I was just going to ask you,
Yes,
do
I
you
do
give
take-
your do you
yes.
give yourself
Yes,
bath gloves? And
yes.
is there any bias that comes by giving yourself any medicine actually, just out of interest?
Sometimes,
Yeah.
yes, because when you can't self-medicate.
Exactly.
You always need someone who would understand you, who would understand what you are right now going through.
Yeah, yeah.
It's self-medication. It's not that easy.
Right. Yeah. Well, I mean, it's fascinating. I think we can go on about talking about this Bach flower therapy, but it's so important that people realize that the emotional side is so powerful in terms of how you can control your wellness, your overall well-being, based on how your emotional wellness is. And that's what you started with. When I asked you, I asked you what is Bach flower therapy. You said, actually, let's take a step back and understand what is emotional wellness. And it's not just about suppressing emotion. It's about dealing with them, addressing them in a healthy way, and in a fairly quantifiable metrics that you pointed out. So it's not just up in the air, so to speak.
Yeah, and I think even WHO defines health as mental, physical,
Yeah.
social being, and not a disease. So social being again is very important
Hmm.
when it comes to only when you have obtained your emotional wellness.
Absolutely. And the more I've also been learning about more therapies that we do over here, this one particularly, since I've mentioned now a couple of times already today that I've started doing this with you and, starting to see the benefits as well. Hopefully they'll get better as we go along. But the point I wanted to make is that you start realizing is that it's not two sides or three sides like what you're talking about. There's emotional is one side, or mental is one side, physical is one side. It's all one thing, and it's not just one or the other. Your body is your body. It's not like you have an emotional side that's not attached to your physical side, or your mental side that's not attached to your emotional side. It's all just one thing, and everything kind of just mixes itself, which is why we say holistic wellness, because it's all one thing.
Yeah, you cannot do a differentiation in physical health
Yeah,
and emotional health. Emotional health is one of its foundation for a physical health.
Absolutely.
You can't, because it's all intertwined. It's intertwined together. It's like any emotion, it passes through your body, even through your physical body.
One body.
Yeah.
Yeah.
And And that's the reason it shows it's different. For example, fear. If I have to talk about fear,
yeah.
like because that's something very common.
Yeah, you said that's one of the most
That's
common
one
ones.
thing.
Yeah.
So, like how emotion is going to pass through your physical body. So, fear, first thing what will happen when you have fear, your heart will race. You will start getting tightening of muscles, palpitations. You'll start having fight and flight response. So, like sadness, what will happen? You'll slow down, your heart rate will go down.
Yeah.
See how nicely it's connecting to your physical body. And you'll have low energy levels when you're sad. Same with anger, your blood pressure will rise. You will start feeling aggressive. You will tighten your muscles, adrenaline rush, and this itself says physical body is not other than that emotional health.
Absolutely.
They're just
It's all
connected.
all one thing.
Yes.
Lovely. Any last words that you like to leave us with? Any last thoughts about this beautiful topic that we've been talking about today?
First thing I'll always say, address your emotions.
Raise your emotions.
Address.
Address your emotions.
Acknowledge them.
Right.
Before all this, I'll say pause. Just pause.
Slow down.
Slow down. Take a break. 1 minute silence will not make any difference. So just silence. Silence your conscious mind, which is right now raising a lot. So silence your conscious mind. Acknowledge your emotions. Don't judge them. They are honest response of your body. So just don't judge them. Talk to someone who you trust.
Right.
It's always nice. Just talk.
Getting it out.
Yes, just vent it out. Practice every day, daily for your quiet reflection. Practice every day 2 minutes or 5 minutes of your journaling. I'll not say meditation, I'll say breath work, spiritual upliftment.
Yeah.
And you will see the difference, how gradually you're shifting from your imbalance to a balance.
Balance. Right.
Because emotions are going to come. The fear, stress, anxiety is going to be there.
Life.
It's how you navigate through this. Very nicely through this emotional.
Right.
Being resilient and addressing all your emotions and having an emotional balance. And Bach flower therapy is a gentle pathway for this.
Lovely.
Yes.
Absolutely. I mean, yeah, for me, I loved absolutely everything that you just said about these last points. But the one that just keeps sticking with me from what we talked about today is that don't suppress. And whatever form that might be, as you talked about, in these last few points about journaling or breathwork or whatever it is, the point is we're not trying to suppress anything over here. Just addressing them and
clear and flow, have a clear flow with yourself.
Right. Lovely. Thank you so much. It's been absolutely lovely hearing what you have to say and the importance of what you say. So hopefully we'll get more and more people getting into Bach flower therapy, and hopefully as a society, everyone can calm down and slow down as well. So thank you so much for being here.
Thank you so much. Thank you for having me.
Thank you. Thank you all. I hope you enjoyed this week's episode. But before you do leave, please do not forget to hit the like and subscribe button here at the bottom. Any comments that you may have, we always love hearing from you. So thank you very much, and we will see you next week. Thank you.